Alyssa, it's so interesting to me. Every week we get to speak to people who are tackling big common problems that are not unusual. They're everyday fare for you in your office, and yet there's so little information and understanding about either the diagnosis and or the treatment. So today we're talking about UTIs, which if you've ever had one, you know it. So what are some of the basics that people can do, in terms of lifestyle to at least reduce the risk of getting a UTI?
Yeah, look, UTI or urinary tract infection usually presents as that unbelievable urgency to have to urinate, pain when you go, frequency, and really can progress quickly to become something somewhat serious with kidney infection and even a blood infection in rare but serious cases. We always talk about the same lifestyle habits that might help. So for example, when using the bathroom, always wipe from front to back so that you're not bringing fecal material with lots of bacteria towards the urethra. That can increase the chance of an infection. We talk about hydration because the dehydrated status might increase risk of infection. Urinate after sex if you're somebody who is prone to UTI. These are three simple things, but they're not the end-all panacea for everybody because UTIs are incredibly common and recurrence risk is very common as well.
Today our founders that we had for MyUTI said something that I really like is just because something is common doesn't mean it's normal, which is really a wake-up call to say, pay attention, to your symptoms. And, I always say the best thing you could do is call Dr. Dweck. So I'm sure your phone is now ringing off the hook for the 10,000 people I've recommended you to in your already busy practice. But if you could tell patients one thing who think they have a UTI, what do you want them to know?
Well, for sure, if it's the first time you think you're developing a UTI, please do check in with your healthcare practitioner. For most people in my neck of the woods, that is your gynecologist, but your internal medicine doctor can help. If you have seen a urologist before, that's certainly a good avenue to pursue, but really needs to be checked out if it's your first experience. Once you've experienced one UTI, you typically know when you're having another, and you can go ahead and phone in to your healthcare provider to see if you can get some assistance and maybe even a prescription. But as we're going to talk to Megan and Lindsey, we're going to find out that there may be some other options that are very viable.
Welcome to the Business of the V. Hello, friends and colleagues. I'm Dr. Alyssa Dweck.
And I'm Rachel Braun-Sherrill. Each week, we bring you the most fascinating investors, inventors, entrepreneurs, academics, and healthcare practitioners who are making things happen in women's sexual and reproductive health.
If you are a woman, know a woman, have a business, or care about your V health and wellness, fasten your seatbelts and listen in to another informative and inspiring episode.
We are so excited today to welcome our two guests, Lindsey Williams and Megan Henken, who are the co-founders of MyUTI. Welcome, ladies.
Thank you for having us.
Hi there.
So for those of us, I can't imagine who it is, who doesn't know what a UTI is, why don't you just start with what you guys are talking about and how you wound up getting into this space and starting this company?
So for those who don't know, UTI is shorthand for urinary tract infection. And Megan and I have both been in the healthcare industry for over 15 years each. My focus had historically been on the men's health side in urology. So I used to joke prostate to penis. And Megan had been in more of the women's health, sexual wellness, and infectious disease side of things.
So you're speaking our language, right in our sweet spot. So often we find that the founders in this space, often women, have had a personal experience where they were dissatisfied with the options that they saw and said, you know what, I need a better solution. They find one and know immediately that there are lots of other people who have this and they could make it into a business. So was that your situation? Were you suffering from chronic UTIs or was there some connection?
Yeah, absolutely. I think Lindsay and I both have the personal and the professional connection. So Lindsay mentioned we had both been in this space and so had worked with different organizations that were using advanced technologies for urinary tract infections. And then personally, I had a grandmother that was dealing with these recurring infections and saw the multiple antibiotics that she was taking at the same time and was appalled that she didn't recognize she wasn't supposed to be doing that. Um, but going back into my personal history, I have always struggled with recurrent UTIs, even as a little girl. So going up through those different phases of my life where there was a lot of blame put on me when I was very young. And then when I was a teenager and into my 20s, became like this shameful thing around sex and being dirty and wiping appropriately. And, that is a big part of our mission is that just because it's common doesn't mean that it's normal. And getting into the right hands and getting into a clinician that is willing to listen to you, finding reputable information on the website on any sort of website is really hard these days as well. There's mounds of misinformation. So yes, I would say short story, very personal, and the professional connection.
Yeah. So, I'm a gynecologist. Obviously, UTIs are kind of bread and butter for gynecologists. However, I'm really kind of saddened to hear that you feel that the layperson feels this is a shameful situation. It's really never been linked to hygiene in our practices. In other words, it doesn't seem like it's someone's fault. But I'm really glad that this is being brought to the forefront. I think what's scary to me is that, these UTIs are incredibly common. More than 50% of women have had at least one, and many, many, many more have had recurrent infections. And yes, there are a couple of lifestyle habits that can be made in order to lessen the risk of a recurrence or an infection in the first place. But then there are those who are truly suffering and those who are really high risk. So the elderly, pregnant people, people who are maybe have an anatomic anomaly. But what I'm seeing in my office, which I would love for you to address, is that nobody wants to come in to have their UTI diagnosed or treated. They want quick 1, 2, 3 treatment over the telephone, and they give you their symptoms. And yes, we try to make like a very educated guess based on symptoms, what's going on. Was your mission to address this? Because that's what we're seeing all the time.
Absolutely. For someone who's had their very first UTI, obviously an empirical treatment with, to your point, an educated guess on the right antibiotic is absolutely appropriate. What we have noticed is that this convenient aspect of just get me the drug, right? I don't want to have to deal with this anymore. I'm very uncomfortable. I'm in pain. I don't have time to take off work. Why should I drive into your office to pee in a cup? Right? That lack of education around the importance of proper antibiotic selection and how important that is, especially for a recurrent situation where, like, the American Urological Association in their guidelines recommends do not treat, right, without a diagnostic confirmation of a UTI in a recurrent situation.
Which is so interesting because ACOG, which is sort of our little governing body, absolutely recognizes the appropriateness of treating a UTI on the telephone without having a culture. So it's really tough to navigate that because these are two very well established and well respected, organizations.
Absolutely. And I think what we're noticing from a consumer perspective is that convenience is trumping a lot of other aspects of healthcare, right? We just have an elevated expectation of how we want to experience healthcare, and speed is paramount. We are also seeing that people are starting to become a bit more sensitized to the idea of antibiotic resistance, antibiotic overexposure. And so there is a desire for understanding, especially in these recurrent situations where women have been on multiple antibiotics and the infection just keeps coming back, that they want to make sure they're doing everything they can to identify the root cause so it can be treated appropriately. So by creating a service where we can deliver access to these types of advanced diagnostics in a way that's convenient and gives good, actionable medical insights for a physician to prescribe most appropriately, that there's a market for that and that there's a need.
I just have to go to one thing while it's on my mind. So the urgency that at least women in my office call in for treatment for a UTI is like, I need treatment yesterday. So I would love for you to explain your platform and how acceptable is it for people to wait 24 hours, I guess, to get their results and get some sort of attention.
And that's really what we want to know. I mean, anyone who's had one and likely has had more than one knows how unpleasant it is. And people who are listening and haven't, I'm sure are, hoping that they never have this experience. So how does this work?
Sure. So when somebody comes to the MyUTI website, they order a test. It's delivered to their doorstep the next day. They pee in the cup, and in the same day, they can ship off to our lab, and then the lab reports within 24 hours. So we do have the shipment, right, that is required. So you are going to be waiting, I guess, 48 hours before you would be getting that result. Within that time, you would be able to use Azos because you can use that for a couple of days or use something like that to help with the pain management. I think for us, the biggest thing is that we are looking to serve that population of women, the 4 million women a year that have recurrent urinary tract infections, that this isn't their first rodeo. Okay. So they know to recognize these symptoms. They've been given rounds of antibiotics. They're willing to take those extra steps because the classic model isn't working for them. And so that's really the consumer that we are supporting. This is the woman that knows, hopefully, that they shouldn't just be deciding to take the leftover antibiotics that they have under the sink. And we see that, we see that in some of our own friends and family that'll call us and say, hey, I really do think that I'm getting a UTI. Can I get a test from you? But I also have this like amoxicillin under the sink I think I might take. What do you think? Like, no, time out. Like if you could just wait, go get something and then truly get on something that'll help you clear your infection.
So I'm going to let Alyssa describe why that is such a bad idea, that scenario that you just described. But from listening from a business model perspective, it sounds to me like the lowest hanging fruit in terms of consumers are people who have had a UTI before. So when it comes, they know what to expect. And the diagnostic part is pretty easy and they know immediately what to do.
Yeah. And I think for us, the way that we designed our test, it is a proprietary test where we look at the top 12 pathogens that cause UTI-like symptoms. So we're looking at bacteria and yeast. So we're looking at things like E. coli, E. faecalis, Pneumoniae, and then we're also looking at Candida. And then we're looking at things kind of outside of that. We're looking at ureaplasma and mycoplasma, right? So these are all organisms that can make you feel like you have a urinary tract infection. And I think the other thing that's really important to think about when you're looking at women as they're more perimenopausal is that getting a test like this that is a more robust and you're symptomatic and you get a negative, going with that type of information to your clinician is extremely helpful because we've ruled out so many things. And now you can really start having a decent conversation about hormone therapy or other things that you need to potentially work on to help you find relief. And that's really what we're here to do.
So here's today's hot flash. As many as 4 in 10 women who get a UTI will get at least one more within 6 months.
Alyssa, there's so much in there in what Megan just said. So
lots to unpack.
What's reaction? What's Azos? Does drinking cranberry juice actually work? What are all the things that you want people to know and think about? Because, I'm assuming, obviously, that the intent is not to eliminate any conversation with your healthcare professional. It's just to create a more efficient process for the consumer. So what are some of the questions that come to mind that you have when you listen to this?
Yeah, lots to unpack here. So a couple of things, and I just feel like I have to be a responsible clinician for just 30 seconds and state that if you don't know you have a UTI, you definitely should check in with a healthcare provider, even if it's urgent care, so that these things can be unteased. Number two, the veterans of UTIs, which of course this is the population we're speaking about, will often turn towards over-the-counter, non-pharmacologic, remedies to just feel better. So Azo is a brand. It's a brand of almost analgesia for the bladder to help somebody to feel better and sort of anesthetize the bladder ever so slightly, if you will, in an effort to prevent that horrible feeling of burning or pain or urgency. There are other brands, Urostat. I mean, I'm not here to tout brands. You mentioned Azo, so I wanted people to know what it was you were referring to. Number two, cranberry supplements or cranberry concentrate may be helpful. There are theories to suggest that a particular ingredient in cranberry, PAC, I'll just abbreviate it in that way, may make the bladder a little bit less sticky or more slippery to the most common bacteria that causes a UTI, called E. coli, and therefore make people feel better, number one, but also perhaps help to manage and optimize urinary tract health. There's another supplement over the counter called D-mannose. Some people find this to be incredibly helpful for UTI symptoms, others not so much. And, the literature and general clinical studies are somewhat limited, but nonetheless, anecdotally, people find these things quite helpful. As far as other issues of concern to me as a gynecologist, because of course, who comes to me? The people who are not getting better or the people who are super sick, okay? So pregnant women have no business doing this. Pregnant women always should be checked out by their obstetrician without question. Number two, an elderly person can have the progression of a simple UTI to a very serious septic situation quickly. And so those people should likely be seen by their healthcare providers. What I find most interesting is the type of testing you're doing with your urine. This is not just a simple dipstick where we're looking for potential signs of a UTI. It looks like you guys are doing PCR. So maybe you could just explain that a little bit.
Yeah, it is PCR-based testing. And so that is why the analysis does happen a bit quicker, right, than doing a culture. We are looking at clinically significant thresholds. So making sure somebody has enough of the organism there is very important anytime you use PCR testing. And then what we do on top of that is a infectious disease algorithm that then grades essentially the type of antibiotic you should take according to the organism or organisms that are found, because data suggests that up to 30% of infections, women that have infections that are recurrent UTIs, are because of multiple organisms. So that is the advantage of PCR technology, is that you can see more things from a single sample.
What are you hearing from people who have, used the old method, which is maybe waiting to go see a doctor or treating what sounds like inappropriately without under a doctor's care? I imagine for the people who find you and have these recurring infections, they must think they died and went to heaven. What are you hearing from consumers who ultimately get to vote on whether this is a good idea or not?
Yeah, I think consumers are thrilled at the convenience. First and foremost, the information that we provide obviously is very helpful for them, because a lot of times these are women who unfortunately are bouncing between physicians and maybe don't have a continuum of care where they're not seeing their gynecologist or a urologist. They're at an urgent care or a primary care physician's office where they're not getting that continuity of care and, getting prescribed multiple antibiotics, knowing that it's not going away, feeling like it's getting worse, it's disrupting their life, and feeling they can finally walk in the door with answers. Because a big thing that we see a lot is I have symptoms, but my culture came back negative. What do I do now? Right. So being able to either look for organisms that wouldn't otherwise grow in a culture, giving them that next piece of the puzzle to work towards with their clinician, as well as just the fact that it is more convenient than taking off work, finding a babysitter, making an appointment, right? Even urgent care, which you have to sometimes sit and wait for hours to be seen, can be disruptive to your life on top of what is already a disruptive situation.
Just want to know what's done with the results. So, you get a result that shows E. coli. Okay, that's fairly straightforward for a UTI. Who gives you a prescription? Does anybody give you a prescription? Are you referred to a healthcare provider of some sort? And, by the same token, you mentioned E. fetalis, which for us is usually considered a contaminant, which we don't treat. Is there explanation to the reports that people are getting and how is it managed?
Yeah, absolutely. So we view ourselves as facilitators for access to care, not care providers. So we do have relationships with both urological specialists across the country, as well as telehealth for women who don't have a clinician to take the result to. And then the result itself does go through something called a clinical decision support software that was written by an infectious disease specialist. And so that not only gives you kind of a better understanding of what was found, but it gives an antibiotic recommendation for the clinician to go off of based on, antibiotic stewardship guidelines, those types of things. It also provides a bit more information, right, about what it is that we found. Is it sometimes a common contaminant, but at this level, right, it constitutes something that maybe should be addressed. And so that education piece is really core to our commitment to women to empower them with knowledge as well as actionable insights.
So in terms of other choices people might make, you've laid out some of the things not to do. So ignoring it, self-treating, using leftover antibiotics. Are there other options? One of the things we hear in this space over and over again is we all welcome competitors because we want people to have the language and the vocabulary and the understanding to do this better. If bad is treating yourself or doing nothing or using an expired antibiotics, what are the options? Are there other folks out there taking a similar approach, and how does that work?
So we are currently the only go-to service for women with advanced testing for urinary tract infections. Obviously, there are a lot of options that are over the counter in terms of dipstick, which Dr. Dweck, you covered, right? Not a diagnostic. And then your traditional kind of healthcare model of making an appointment with your primary care, your gynecologist, seeing a urgent care center physician, or leveraging telehealth. And again, I think for a first-time UTI, those are all wonderful options. By the time you've had your second within 6 months or third within a year, it might be time to look at something that includes, at the very least, making sure you're getting a urine culture prior to getting prescribed an antibiotic. And if that's not successful, then certainly looking at this type of technology is warranted.
Yeah. So I'm assuming, based on you being at a urologic conference and you're using an infectious disease specialist, do you have a medical advisory board? How are you navigating that portion of things?
Yes, we do have a clinical advisory board as well as a technical advisory board. So I think having been in this space for a number of years and doing marketing within this space, I'm keenly aware and extremely sensitive to making sure that any claims that we make are evidence-based, that that any of the content that's put on our website, we do have reviewed by our clinical and our technical team. Our panel also was vetted by our technical team. So we definitely recognize that we are not clinicians. We are just extremely passionate and well-read in this space. So for us, making sure in this environment that we are the ones putting forth things that are easy to consume, because these infections can get very complicated when you start to talk about biofilms and how these different organisms interact with one another and can cause different types of symptoms that relate to overactive bladder, right? So you start crossing into a lot of things. So we just really want to be cognizant that we're putting forward accurate and palatable information for the everyday consumer.
So you've now set up this system and you have this screening and you're looking at many, many organisms. So my assumption is you could use this system that you've set up and start testing for other things. When you look up the road or down the pike, however you want to describe it, what is next for MyUTI?
Well, I think first, the benefit of establishing MyUTI as a trusted brand is that there are so many places that we could go, right? And the PCR technology and technology in general is evolving at a rate that allows us to kind of continually explore new areas of women's health and pelvic health. There are a lot of companies out there right now doing consumer first STI type of testing, but certainly we see where there are certain STIs that can mimic similar symptoms, that could be a nice little add-on. We think, looking at, as Megan likes to say, that 4-inch region, there's a lot that can happen within, and that is definitely something that we're looking to build, right? Not just a UTI company, but a women's health company that can serve as a platform that's trusted, that can have network effect.
Awesome. So where can people learn more about MyUTI other than hopefully your website is called MyUTI?
It is myuti.com. We are also on Instagram and really stepping outside of our comfort zone and have just also joined TikTok. So you can find us there too.
Fantastic.
You know what I love is you said something at the beginning, Megan, that I just want to reiterate because I think it's such a good lesson to think about when we talk about the complexity of women's health. And that is just because it's common doesn't mean it's normal. So, kudos to you for getting people to ask questions and get information so they don't live with something that might be very minor now, but could grow into something much worse. So we're here wishing you continued success and thanks for all the terrific work.
Thank you.
Thank you very much.
Don't forget, subscribe to our podcast at businessofthev.com for the latest trends and trendsetters in women's health and business.